Well, there is, of course, a lot of good things in this legislation, even without the Medicare buy-in or the public option. But one thing there isn't is serious pressure on insurance companies to control costs, and also a real check on the insurance companies if they don't live up to the promises they've made or abide by the regulations. I think that the most important thing that can be done at this point is to strengthen the regulations on the insurance companies and make sure that people have some kind of alternative to what's offered to them within the state exchanges that are envisioned in the Senate bill. I would argue that one element of the compromise deal that was talked about, the idea of creating some kind of national private plan or plans, would be a good idea if they had a heavy overlay of public-spirited regulation. I'd also argue that insofar as possible, we should try to move the bill toward the House version, especially with regard to the authority that's given to the federal government to regulate insurance, because the Senate bill, no, it's Freudian slip. The Senate bill is also a state bill. It's much too focused on the states, and I'm fearful that some states are just not going to be able to handle the mammoth tasks that they're being granted. I also agree with Maggie. One of the big problems with this bill is there really aren't a lot of tangible achievements before 2014 if you look at the Senate bill. And there should be real pressure to, first of all, try to include some things up front that people will see as positive. And second of all, to recognize that there's an agenda for doing more in the next few years to try to make sure that people see a concrete positive change in their lives even before this legislation comes online.